Right, so I'm here to talk about, so everyone's been hearing about different destinations for surrogacy today, but I'm actually here, I've been doing some research with the London Women's Clinic, which is affiliated with London Egg Bank, which is one of the talks that you heard first thing this morning if you were here, and also affiliation with London Sperm Bank as well, to talk about what we know. Also, my brief from the research I've been doing is what we know about the number of surrogacy treatments taking place in the UK clinics, including the proportion of those that are undertaken by same-sex male couples and the proportion that involves frozen donor eggs. I was also asked to sort of discuss a bit why do intended parents seek surrogacy and who the surrogates are, and sort of what they think about it all, because that's kind of what I've been doing. So I've been employed by London Women's Clinic to undertake a study of the surrogacy program they've been running there, and to sort of dig down deep into it. So what we know, the assumptions we have is that the surrogacy in the UK, the numbers of surrogacy journeys that are taking place through clinics in the UK are rising in popularity despite some real and perceived social and legal barriers that exist out there. So we're looking at how that's played out on our surrogacy program over time and assessing whether sort of some societal and legal and other changes have had any bearing on that over the time. Also scientific advances. You were hearing earlier about big changes in the way eggs can be frozen and the effectiveness of that. And we're looking at the sort of changes in demographics that any of that has brought to bear on people accessing surrogacy. We're hoping that some of the findings we have, when I eventually get around to writing any of this stuff up, will feed into the upcoming debates on surrogacy law reform. I don't know how aware you are of it, but the Law Commission is currently looking at surrogacy and planning to make recommendations for legal changes. Autumn is their time frame, is when they're going to be reporting, and so there may be some changes to come about what can and can't be done or how it works in the UK. So key findings from looking at just the sort of cohort of our surrogacy treatments that we've done in London's Women's Clinic between 2014, which is when the first embryo transfer in a surrogacy journey took place, to 2021. So this data only goes up to the end of September last year, and there have been more treatments that have taken place since then, but that's the period I'm studying. What we found is that surrogacy treatments have just, they've been gradually, there's been more year on year taking place. There's a slight dip in 2020, but that was pretty explainable by COVID. The clinic was closed for a number of months. In that time, in that sort of 8-year-ish period, we've had 109 surrogates that have been treated at the clinic. There's 179 embryo transfers have taken place to those. The clinic operates within HFEA licensing rules, so we're looking at a one embryo at a time policy, unless there are certain circumstances that dictate that it might be two, but it's never more than two. And that's on behalf of 112 intended parents. I mean, they may be 112 couples, but they're not all couples, some are single. In that time, there have been 68 babies born to 58 of the surrogates, and at the time I was looking at this, there were 8 pregnancies ongoing, many of which have now resulted in lovely babies. I get sent pictures every now and then, which is very nice. Speaking sort of statistically, there's no significant difference in live birth rate between, sort of stratified it into 4 different categories of patients. So you have heterosexual couples, married or unmarried, same-sex male couples, unmarried or married, single intended parents. We have male and female single parents who've gone through a surrogacy journey, and we have had transgender patients.
Sorry, do you mean the outcome is noted not different in terms of likelihood of success, or do you mean that they are a quarter?
Oh, no, yeah, the likelihood of success, so the live birth rate as it is presented on a cumulative scale. We have seen there's an increase in frozen eggs over time. More and more couples are doing that. Some of that is accounted for by the increase in proportion of same-sex male couples coming through, because obviously they need to bring an egg or have an egg, and that's why we are affiliated with London Egg Bank, who are sat at the back there. And it now surpasses the use of fresh eggs in surrogacy treatment. So that's not embryos, so frozen embryo transfer and fresh embryo transfer, that's a different thing, but actually the use of eggs that were previously frozen to create those embryos. And I mentioned the proportion of same-sex male couples is increasing. And as far as we're aware in this study, and I've surveyed the surrogates and surveyed the intended parents, and I have interviewed many of them as well. As far as we're aware, there's no issues with disagreements between surrogates and the intended parents in those 68 babies that we're talking about. So I haven't come across any, fallings out or anything like that. It's all been kind of very happy. And to the best of our knowledge, all the parental orders have gone through smoothly afterwards, because it would be the case that we might get notified or asked questions if it wasn't a smooth process. And many of the intended parents who have been successful or not still have embryos in storage with us and are considering or planning a sibling or further journey with us. So this, is pretty self-evident here on the demographics. So this is that period 2014 to 2021 up to September. The sort of greeny blue line is heterosexual couples. The pinky line is same-sex male couples. So you can see that proportion has gradually increased. In 2017, it overtook the proportion of heterosexual couples for the first time, and that was again evident in 2021. Why that is, maybe what I was referring to about the sort of social and legal changes that are operating in the background of all this that have led to easier access. You can see there's not many singles or transgender on there. This is the picture about frozen eggs versus fresh eggs use. You can see it's quite stark, actually. Like I say, pretty self-explanatory. So the greeny line, again, is frozen eggs, which, when technology wasn't quite as good as it is now, was a lot lower than it is. And as the technology's got better, it has flipped, like literally flipped the picture, and fresh egg use so this is only in surrogacy treatments. This isn't in IVF in the clinic across the board, but in the surrogacy treatments, this is what the picture looks like now. It's the fresh egg use is in complete decline. So that's kind of it. So our initial sort of conclusions on looking at this picture of surrogacy that we can see from these people illustrates perhaps how social, legal, clinical developments have led to a steady rise in surrogacy generally. I mean, we're not talking massive numbers. There aren't thousands of people out there doing this. We are one of some clinics that do surrogacy. Not all IVF clinics do surrogacy treatments. As I said, there's an increase in same-sex male couples accessing surrogacy, and that may well be because of legal and social things going on in the background, such as, for example, the introduction of same-sex marriage in 2013. This pattern may also reflect sort of higher visibility and acceptability of surrogacy generally over the last decade, including campaigns that have been out there highlighting the positives of UK surrogacy rather than having to travel overseas for it. There is support from the Department of Health and Social Care for surrogacy. They have, the government's voice has said surrogacy is a legitimate and acceptable form of family building. There have been changes in legislation allowing more people to apply for legal parenthood following surrogacy. So, for example, in 2019, the law was changed to allow single people to access parental orders after surrogacy, where previously that hadn't been the case. The increase in frozen egg use has the benefit of flexibility, so that is changing the sort of pattern of surrogacy treatments as well. You don't have to synchronise people's cycles quite so much, and so it's just easier to plan your time a bit more with this. And the outcomes obviously are reassuring that there's not sort of one group that is doing better at these kind of treatments than anybody else. However, we understand, and certainly from the interviews is backing up work I've done previously. The current legal position on surrogacy does need reform. Thankfully, that is happening. It may make things much easier in the future. As I said, the Law Commissions are expected to report. I say Law Commissions because it's the Law Commission of England and Wales and the Scottish Law Commission who are looking at this jointly, and will report with some draft legislation in autumn. So you can expect it to, infiltrate into sort of public debate and stuff round about then. So because of that, because this is going to be sort of public and parliamentary debate from autumn onwards, I would think, things like follow-up studies, campaigning, lobbying is important. So this is a follow-up study, doing the things like interviews and all that kind of thing. So this is the same cohort but updated just a bit, so there's one more surrogate included in this little follow-up study. We were looking at how surrogates and intended parents experience their journeys both clinically, so that we could learn as a clinic what works well and what not so well, and also using that sort of lived experience. And it's sort of my opinion, long-standing opinion, that actually the voices of people that need to be heard and amplified in this debate are the people who've actually done it and not the people who've just observed it from the outside, the voice of the people doing it. So that's kind of what we're trying to do. We'll write this up and hopefully people will read it. So I did a survey of the surrogates that had come through London Women's Clinic last year, closed towards the end of November. There were 110 surrogates that were sort of in the pool to start off with. 10 of those we had to exclude for various reasons. I mean, some as simple as not holding an up-to-date email address for them, that kind of thing. A couple self-excluded themselves, for their own personal reasons. So there were 47 responses to the survey in the end. 37 agreed to a follow-up interview, and as of a couple of days ago, I'd interviewed 24 surrogates. Which has been really interesting and really pleasurable. Similarly with the intended parents, there was a different survey. Some of the questions were the same, but obviously it was tailored differently. And it was sort of running a sort of 3-week lag behind. There were 61 responses to that, some of which it's quite clear were joint responses, from a couple, even though I'd asked people to fill it out separately, but time and things are important. 43 of those agreed to a follow-up interview, and I have interviewed 25 of those so far. First impressions from these surveys and interviews are that the clinical aspects of surrogacy are not a problem, no more of a problem for surrogacy than it is in normal IVF. It's not much fun, but that's not what people find hard to navigate. It's all right. Navigating surrogacy itself, how to do it, how to progress with it, what you do after you've had your treatment, all that kind of thing, especially if it's the first time that IPs, it's because I'm used to it all the time, intended parents are doing it for the first time, is more difficult. There's been lots of people who've spoken to me about how hard it was to work out what you had to do and when you had to do it and what you did next and all that kind of thing. But, probably unsurprisingly, that was made way more difficult for the people who didn't have things like legal advice. So people who had good legal advice found it much easier, or people who had support from one of the non-profit organisations that operate in the UK to help people, through surrogacy. So the people who had engaged with one of those organisations, or who had worked with a surrogate who may previously have been, involved with one of those organisations, found it much easier to navigate the whole process than anyone who didn't. And anyone who didn't engage with anyone, no legal advice, no nothing, and relied on the counselling that the clinic offers, which is great, and everybody valued it. But that's just one little piece of the jigsaw. The ones who put more pieces in the jigsaw together had a better experience. Most people, and it's time specific on this, because the Department of Health issued guidance about surrogacy, about the process of surrogacy, and I guess good practice in surrogacy in 2018. So lots of these people did it before 2018, so wouldn't have been caught by that. But I was asking people how aware they were of that guidance. So there's two sets of guidance, one set for surrogates and intended parents going through the process, and one set of guidance for people who are supporting people through the process of surrogacy. And the absolute majority of people I've spoken to who have engaged with surrogacy from 2018 onwards have no idea that there is guidance from the Department of Health about how to go through surrogacy. But that guidance is really good. It's on the Department of Health website. It explains the roles of the sort of non-profit organisations that can help. It tells you which ones are the ones that it sort of endorses. It tells you about the value of legal advice, about counselling, all those kind of things. In the Law Commission's earlier, like their sort of pre-proposals that came out in 2019, they proposed, so there is a proposal to change the law so that intended parents can be the legal parents at birth. So not quite the same as some of the things you've heard like Greece and other places where you get a pre-birth order, but at birth there is a possibility that the intended parents will be the legal parents if they follow this particular pathway that the Law Commissions are proposing, which basically involves taking all those steps, putting those pieces of the jigsaw in, and if you do those, then you're on the pathway to having legal parenthood at birth. Some things will be excluded from that pathway, such as if you just found a surrogate online and didn't engage with clinics or the legal process or anything like that, that would be excluded. Overseas journeys, it looks like, will be excluded from that as well. So if you do go overseas, you do have to do, I don't know if you're in the session with Karen earlier, but you still would have to apply for a parental order if you're not on that pathway. So there'll be sort of two ways of doing it. Who's to know whether that proposal stays the same in autumn, but it doesn't look like there's going to be much change. There's been general support among all the people I've spoken to for the regulation of these non-profit organisations. That's one of the proposals. They'd be regulated like clinics are regulated by the HFEA, and because people thought that would give legitimacy to surrogacy, but they're concerned that it increases the costs. There's some support for a modest or capped figure to be allowed to be paid over and above the reimbursement of expenses, but that mostly comes from the intended parents, not the surrogates, which was quite interesting to hear, because they are so grateful. And so they're like, well, we'll do anything. And there's loads, almost without exception, all the people I spoke to have ongoing contact between the intended parents and the surrogates wider family and the intended parents' wider family. There's, so much. Very quickly, last bit, the surrogates, who were they? So, there's a lot of assumptions made, I think, about who are surrogates, but actually almost all of the surrogates were professionals from one range to another. There were a lot who were involved in healthcare of one type or another, quite a lot involved in teaching or childcare of one type or another, but there's a wide range of professions. There's 3 solicitors in that bunch of surrogates that were studied, which, I think is surprising to some people. Oh, you want that? I can't see the slide now. That's fine. Why they did it was also a question I asked, and lots of them did it because either they themselves or someone they knew had experienced fertility issues in the past, and so it was an empathy thing. Every single one said they didn't view themselves as the mother of the child. None of them had used one of them had used their own eggs. But even she said she didn't view herself as the mother of the child. She had also been an egg donor. She'd also been an egg donor separately from the surrogacy. So she said, it was just like doing egg donation and surrogacy at the same time. I don't view myself as the mother of that child. She went on to do a sibling journey as well for the same intended parents, again using her own eggs, but she's the only surrogate through this cohort that had used her own eggs. Everybody else had used either their own eggs if they were able to, or donor eggs. And none of them said they want parental responsibility at birth. They don't want to be the ones that make the decision if there's medical decisions to be made about the child or anything like that. They want to abdicate that to the intended parents who they view as the parents. So there's lots of sort of language things that people use which is about, you know, it not being their child, it being the intended parents' baby, that kind of thing. For the intended parents, they are all just really grateful, including the ones who haven't had babies yet, really grateful just for the opportunity to try, at least. But there's loads of concern about getting it wrong, and that's come out in previous work I've done, like getting one of the steps along the way wrong because people think they won't get a parental order if that happens. And actually, like I say, everyone who had done it has got their parental order as far as we know. And one other thing I found from them is that a fair few had considered overseas surrogacy or had considered adoption from overseas, but they'd rejected it either for cost or for ethical reasons. That's their words coming through, that they didn't like it for ethical reasons, and had made a decision to stay in the UK on that basis, even if it took more time. And on time, we're not seeing any sort of bigger time. So I was quite surprised, actually, at some of the talks earlier about how long it takes through some of these other jurisdictions, and there's not that much difference, actually, if that's what that is. I was surprised they were so long. And that's it. That's all. Thank you.
Thanks, Kirsty. That's great. Really good. Thank you so much.
Yeah, I had to rattle through it.